Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Doctors in Cross River State lament neglect of cancer during pandemic. Executive Secretary of the Taraba State Primary Healthcare Development Agency says vaccines are not likely to waste because they come with long expiry dates. And South African scientists make a copy of Moderna COVID-19 vaccine. Lagos, Yobe and the Federal Capital Territory topped the chart of infections recorded last night, according to the Nigeria Center for Disease Control. The report also includes 158 community discharge cases for the FCT and others for EMO. Here's more on the pandemic update.
100 additional persons in Nigeria have tested positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT, and that's an increase from figures reported earlier. Lagos accounted for the highest number of cases with 22 infections. Yobe came in second with 18, and the FCT had 15. Ogun and Osun states had 7 cases each. Oyo and Sokoto had 6 cases each. Imo registered 5 cases. Other states that reported cases in single digits include Kwara, Bauchi, and Edo State. The total number of confirmed cases in Nigeria now stands at 253,505. This report includes a backlog of confirmed cases from Bauchi State. No cases were reported from Ekiti, Ondo, and Rivers. 217 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 229,893. There was no additional death recorded in the last 24 hours, leaving the fatality toll of 3,136. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 patients, followed by Ondo and Benue states. Over 15.3 million Nigerians of eligible age have received 1 dose of the COVID-19 vaccination, while more than 5.7 million of the population have been fully vaccinated. Globally, the total number of confirmed cases has surpassed 388 million, while deaths are now beyond 5.7 million.
Meanwhile, as the world marks the 2022 World Cancer Day, groups in Cross River State are calling on both the federal and state governments to create awareness about the importance of early detection of cancer, especially since the COVID-19 pandemic has taken attention of other diseases. Speaking at the Nigeria Police Command in Calabar, the Cross River State capital, the co-convener of the 2022 World Cancer Day restates the importance of early detection as the effects of COVID-19 on those with cancer are more pronounced.
Several police officers from the 18 local government areas of Cross River State are benefiting from free mammograms as well as cervical and prostate cancer screening in order to know their status. The screening officials explained that the challenges are enormous as attention deviated from cancer to COVID-19 for a long period of time.
COVID has affected the treatment of cancer a lot. In fact, because of COVID, cancer has actually been neglected because COVID kills faster than cancer does. So that is why we are asking that people come out and get screened so that the earlier you find out, the earlier something gets done about it. Cancer is not a death sentence. There is something inside cancer you find can. We can work together to make sure that the mortality rate is reduced. People that actually die of COVID faster are people that have underlying illnesses. Example, cancer.
With cancer, there's depressed immunity. They come down with some form of immunosuppression, so which increases their susceptibility to coming down with COVID. So advise patients who have cancer to also get the COVID vaccine, as this would help reduce the severity of the disease should it occur.
With the theme, Close the Care Gap, this awareness campaign comes to members of the Nigeria Police to ensure that while they perform their duties of saving lives and property, they also stay healthy.
Early detection is very key. So this effort is an effort directed at early detection. We do screening, and if you're able to pick up any case from here, we follow it up.
In police, you have the right to go to hospital for checkup. You just book hospital, and you're allowed. The authority knows about this. Nobody has said, I'm sick, that will not have been privileged to take care of himself or herself.
With this advocacy and free screening continuing until the end of October, a great number of residents can avail themselves this opportunity to know their status and get treatment if needed.
The Taraba State Primary Healthcare Development Agency is assuring residents that the vaccines at its disposal are safe, has long shelf life, and is effective for administration. According to the Executive Secretary of the agency, this has become necessary following the tension generated by the discovery and destruction of expired COVID-19 vaccines last year. He reassures that the state agency is using the first-in, first-out strategy to forestall such occurrence.
Vaccines are not supplied directly from outside the country to states. They follow the normal channel of supply of vaccines through the Federal Ministry of Health to the National Primary Care Development Agency under the leadership of the Logistic Working Group. Having said that, all vaccines received in the state are vaccines that are being supplied through National Primary Care Development Agency, and vaccines have shelf lives. They have expiring date and what have you. For what has happened last time, I think the National Primary Care Development have made a statement on that. But for now, I want to assure you, all vaccines in our custody have a longer life shelves that can take us up to 6 months, some even 1 year.
The study was published yesterday in Nature Communications, suggests that there are multiple expansions of globally uncommon SARS-CoV-2 lineages in Nigeria. Northwestern scientists sequenced nearly 400 nasal swabs from Nigerian COVID-19 patients collected by a collaborator, Dr. Moses Adeomi and his team at the University of Ibadan, who shipped the specimens to Northwestern for sequencing and analysis. Now, the Ibadan scientists did not yet have the equipment or resources to sequence samples at their own institutions. Well, the results, according to the scientists, were unexpected. Renowned professor of virology, Professor Yewale Tomori, joins us now for more on this. Thank you for joining us on the program.
It's my pleasure. Thank you very much.
What's your take on the study, which suggests that there are multiple expansions of globally uncommon SARS-CoV-2 lineages in Nigeria?
First, thank you very much. I'd like to congratulate our colleagues who collaborated with Northwestern University. As you notice, all of the samples were got from Ibadan here. But that's what distresses me about this country. Anyway, let me come to that one. It is the Ibadan lab may not have the facilities, but there are labs in this country that have the facilities to carry that assignment out. And that's why I say I'm very distressed because of our lack of collaboration amongst ourselves. And that's why we're sending samples to Northwestern University to test, when there are labs in different parts of this country that could have done exactly the same thing, that are also discovered the same thing long time before Northwestern people did it.
So essentially, is it the procedure, is it the logistics? What do you think is preventing this collaboration if, we could have done it here?
First of all, it is lack of proper coordination from the NCDC. That they are in charge with that one. And they to make use of the laboratories we have in this country. The lab in Ede and all those places, we have this problem in our country. They tell you it's in a private place. But then we forget that that place was established with money borrowed by Nigeria from the World Bank, and we're paying for it. But because it's situated in the private sector, we refuse to collaborate with each other. And that's why samples have been sent to Northwestern Union. We shouldn't be sending samples to such places. We should be doing this type of thing in this country. And that's very distressful. Go and check the records of the NCDC. This same variant, B525, have been reported in this country several times before. If we have been collaborating amongst ourselves, this so-called ETA variant, we will have discovered it. Way back in 2021, they've done that one. So this is what is wrong with us. That's why I'm distressed about this. I'm happy for our colleagues who did with Northwestern, but I'm distressed that this situation, I mean, you go and read that report. It talks about the problems that we have in Nigeria. We know we have the problems, but it's not for public exposure because we have the capacity, we have the capability. We will not collaborate with each other, and that's what is causing the problem. We should be unhappy with ourselves as a country.
The report also talked about international collaboration, saying that this is important with the kind of surveillance, genomic sequencing that we need to do going forward.
I have no problem with international collaboration, but what you can do in your country, why are you not doing it? Why are you carrying the basic thing you can do to international collaboration? International collaboration means you contribute, I contribute. It is not for them to do it all. That is not international, that's slavery. We are giving ourselves in the situation in which what we can do, we're not doing it because we're not collaborating amongst ourselves at home. That's the problem. We suggested the federal government a long time ago to organize, NCDC to organize this network, but they will refuse and won't do anything. And now we become the tools in the hands of people from outside the country. I read that report and I'm very distressed about it.
So what's your take on the study itself, the differences in the types of SARS-CoV-2 viruses found in Nigeria compared to the rest of the world? I mean, suggesting that, you know, there seems to be something happening here.
That's the problem. That study was done with 400 samples from Nigeria. Did they do from other countries? We don't know. They didn't tell us. 525 have been found in other parts of the world. It wasn't only in Nigeria. It was found in UK. It was found in so many other countries. Did they do their study with the 525 of other countries? So you can't do with Nigeria alone and say this is multiple something going on in Nigeria. It is an incomplete study, and that's the point I'm trying to raise.
Let's talk about our response and also our approach to the coronavirus pandemic. Do you think that this has impacted in your estimation of the response so far, NCDC and other agencies in charge?
You know, from the beginning, I've always thought that we were just lucky in this country that epidemiology of COVID in Nigeria or Africa is not like what is happening in other parts of the world. If it had been a terrible thing because we are not doing what we should do. We are not up to it. We are running after the epidemic rather than trying to manage it. And that's the problem with us. Way after the thing has happened, our results are coming out like, you know, soon after the whole thing has happened. So we are running helter-skelter after the epidemic with the poor testing system we're doing in this country. And that's why we're where we are today. We are the mercy of everybody. You remember the Omicron was first discovered not from Nigeria, the Nigerian cases. It was Canada that first reported the Omicron. UK reported the Omicron before we reported Omicron. So this is the problem we're talking about. Outsiders tell us what problem we have, not because we cannot do it, but because our people are not collaborating together and we're not working as a team. And that's where the problem is. And I charge the NCDC the right to collaborate and coordinate. That's the problem. That's the missing link.
I'd also like to ask, I know over the time we've said it, you also said it, that it appears we were lucky, but a lot of people outside Africa are also trying to find out why we appear to have low hospitalization rates, the low deaths. We keep hearing that it's a young population. We also hear underreported cases, lower testing. What do you think it is?
There have been all sorts of speculations, the ones you mentioned. There have also been people who have said that there is some genetic makeup which is preventing us to have severe infection. That is still a speculation, and people need to work. And that is where we come in. We are the ones to do those studies, not to wait for outsiders to do it. If our governments push money into research and science, we will be telling the story for outsiders, not outsiders telling us the stories. We've been saying it a long time ago. We put our money into irresponsible things, and then we see what we become slaves to the rest of the world.
And that shouldn't be the case. We appreciate your time, renowned Professor of Virology, Yewale Tomori. Thank you for joining us on the program today.
It's my pleasure. Thank you very much.
Well, still to come, we'll look at the measures to curb COVID-19 in Europe. Quite unique. Find out more when we return. Welcome back. Scientists in South Africa have made a copy of the Moderna COVID vaccine, a move which they say could help boost vaccination rates across the continent. The continent currently has the lowest uptake of COVID shots in the world. The company behind the new vaccine, Afrigen Biologics, says it hopes to start clinical trials in November. It is also the first mRNA vaccine designed, developed and produced at lab scale on the African continent.
A South African company has made its own COVID-19 vaccine. The company called Afrigen says it used Moderna data to design, develop and produce the first mRNA-type vaccine for COVID-19 on the African continent. It would mean a cheaper, patent-free version of the shot. The WHO hired the company last year, one of several chosen in a pilot program to help low- and middle-income countries crack the code of COVID vaccines. UN health official Charles Gore says Afrigen should help change perceptions about African nations' capabilities.
If this project shows that Africa can take cutting-edge technology and produce cutting-edge products with it, that will banish this idea Africa can't do it. And I hope that will really change the global mindset around Africa. And understanding that, yes, this is about empowering Africa. This is not about philanthropy to Africa.
Afrigen used the publicly available sequence of Moderna's mRNA vaccine. However, the company's managing director, Petro Tablanche, made it clear it's a uniquely designed vaccine.
Moderna sequence 1273, discovered by Stanford University and being completely in the public domain, and we forward integrate making a vaccine with our own processes, partnering with its university, our own knowledge base and public domain information that the team would extract, interpret and utilize.
WHO launched the project after Pfizer, BioNTech and Moderna declined their request to share tech and expertise. However, Moderna pledged not to enforce patents during the pandemic. Moderna is yet to comment on Afrigen's Thursday announcement. The WHO hopes its hub in Cape Town will help overcome vaccine inequalities between rich and poor countries. Some 99% of Africa's vaccines against all diseases are imported, and the negligible remainder is manufactured locally. Afrigen announced its vaccine could be tested on humans before the end of the year.
Away from Africa, Germany's Robert Koch Institute for Infectious Diseases reported a new record high of daily COVID-19 cases today, with almost 250,000 people infected within the past 24 hours. The 7-day incidence rate also increased to a new record of 1,349.5 cases per 100,000 people per week. The new figures come amid increased calls for relaxing current measures put in place to curb the spread of the Omicron wave, but also calls for caution. Deutsche Welle correspondent Janelle Dumalao joins us now from Berlin on more. Hi, Janelle. Why are the cases still rising in Germany?
Well, the main driver of the cases in Germany is really thought to be the more transmissible Omicron variant. It really is the most prevalent strain in the country at the moment, with breakthrough infections. So that is infections breaking through booster shots being entirely common. Now, although Omicron is associated with a milder illness, the sheer numbers of people getting infected are still a big cause for concern here in Germany, especially because around 15% of people here remain totally unvaccinated. Now, that's one of the highest shares of the unvaccinated in Europe, along with Austria and Switzerland.
Well, also, health policymakers hope that the use of a vaccine based on older, more conventional technology like the Novavax will convince the hesitant to get jabbed. Do you think that it will work?
Indeed. Now, just anecdotally speaking, whenever I've spoken to vaccine hesitant people, distrust of the new mRNA vaccines does come up. Many are wary of this new technology and how quickly it was brought to market. They might see a recombinant protein vaccine like Novavax as more established. Now, it's early days yet, but the federal states who have begun to offer the vaccine did see thousands register for the vaccine appointments using this particular jab. So as such, there's reason to be hopeful. But of course, this isn't a silver bullet, and policymakers have cautioned against seeing Novavax as the tool to close the vaccination gap, since it might take more than Novavax to reach what has proven extremely intransigent groups of anti-vaxxers here in Germany.
But apart from Germany, are we seeing an end of restrictions in other parts of Europe?
There are certainly a few countries that are pulling back restrictions. Denmark has said that it no longer considers the COVID-19 outbreak a socially critical disease and has lifted much of its restrictions. Sweden has announced a similar move. France has said that mask wearing is no longer mandatory outdoors the way it has been. In the UK, the only legal requirement is to self-isolate if testing positive for COVID-19. Now, in Germany, where I am, it's still an ongoing discussion, with one side saying that the restrictions don't really make much sense, as Omicron is breaking through them and running unchecked through society anyway. But the other side is saying it is much too soon to lift them, and it would be uncautious to do so. But the next pandemic strategy meeting between German Chancellor Olaf Scholz and the 16 leaders of Germany's federal states is going to be on the 16th of February. So all eyes will be on them to determine which side they eventually land on.
So, Janelle, with infections breaking through boosters, do you see Germany getting closer to a vaccine mandate?
Well, there is one in place already for health workers set to come into effect next month. But as for the general population, Germany is continuing to debate that still. There was already a so-called orientation debate in Parliament last January 26, where positions and opinions for and against a vaccine mandate were laid out. But it was not meant to be the forum where that's decided. So the proposals on the table are a mandate for over 18-year-olds, over 50-year-olds, or no vaccine mandate at all. It has to be said, the majority of Germans do back a vaccine mandate, but such a mandate will have to go through an entire legislative process that could take up to half a year. So in summary, we don't know yet whether we're getting one, but if we are, it does not look like it will be very soon.
Well, the correspondent Janelle de Malaon joining us there from Berlin. Many thanks. And it's now a law in Austria as for all eligible adults over 18 in the country to be vaccinated against COVID-19. This is as new daily cases have tripled over the past 2 weeks in South Korea. But officials there are extending social distancing rules for 14 days. Here's more on the global update.
India's official COVID-19 death toll has officially crossed 500,000. The country, which is the fourth highest tally of deaths globally, recorded 400,000 deaths by July 2021 after the devastating outbreak from the Delta variant of the coronavirus, but some believe the figures were much higher. India is currently in the midst of a third wave of the coronavirus, led by the Omicron variant, which some top experts say is already in community transmission, although federal officials say most cases are mild. According to official figures, India's overall number of COVID infections has reached 41.95 million, the second highest globally behind the United States. South Korea has extended COVID-19 social distancing rules for 2 weeks, including a 9 p.m. curfew for restaurants, bars, and gyms, amid soaring cases of Omicron coronavirus variant. New daily cases have tripled over the past 2 weeks, but the number of deaths and serious infections have remained relatively low in the highly vaccinated country. Still in Asia, in Japan, serious coronavirus cases have gone over the 1,000 mark for the first time in 4 months. Official figures show that the number of seriously ill patients rose by 131 to 1,042 cases, the highest it had been in 4 months. Omicron cases are now dominant among a population where less than 5% have received a booster jab. And finally, Austrian President Alexander Van der Bellen has signed into law a mandate for all eligible adults over 18 in the country to be vaccinated against COVID-19. While some nations like Italy are mandating that adults over 50 or people who work in the medical industry get vaccinated, Austria's new law calling for the vaccination of all adults is the first of its kind in Europe.
Take a look at our websites for more updates and a better understanding of the pandemic, plus other stories breaking at your fingertips. It's channelstv.com. And that's our program for the week. Thank you for watching. I'm Millicent Walker. Stay healthy.